Good afternoon, everyone. Thank you so much for joining us. I see some participants are probably still popping in, but we're really glad that you're able to join us for some information that we're excited to share about the Transforming Maternal Health model for California. I'm Dr. Yingo, the project director, and we can go to the next slide. So the agenda for today's call includes a little bit of time for welcome and introductions. We will then go into an overview of the TMaH model, talk about California's progress to date, and then Dr. Karen Mark, who I'll introduce, will talk about provider participation, opportunities, and some additional details there. We'll have some time for Q&A, and we'll talk about next steps. Next slide, please. Next slide. So for this webinar, we will take written questions. You can submit any questions in the Zoom Q&A box at the bottom of your screen. The Zoom chat is also open and will be monitored. You will have an opportunity at the end of this webinar to unmute and provide spoken questions as well. We'll provide you directions on how to do that when we get there. Today's meeting is being recorded, and we will make the slide deck available to participants and a recording after today. Next slide, please. So it's my pleasure to introduce the core Transforming Maternal Health team at the Department of Healthcare Services. We are in the Quality and Population Health Management Program, but there are many other experts across DHCS who are supporting this effort and across the state. So for our next speaker after me will be Dr. Karen Mark. She is our DHCS Medical Director. Ebony Megabau is our TMaH Project Coordinator. And Dr. Anna Coutinho is our Medical Consultant. Next slide, please. So the objectives of our call today are to present an overview of the key components of the TMaH model so we can strengthen our shared understanding. We will provide updates on the activities that our TMaH team has been doing. We call this period the pre-implementation period. And we will highlight opportunities for stakeholders to provide input on and participate in the model. We will also provide some space for stakeholder questions and feedback. And we want to promote our next call, which will be on October 1st. Please register for this event if you haven't yet. And I believe there will be a link in the chat as well. At that meeting, we will have more discussion time for stakeholders in a group based on county. And we are really hoping to get some interesting and helpful feedback at that time about the implementation of the TMaH model. Next slide, please. An acknowledgement of support. This program is supported by the Centers for Medicare and Medicaid Services of the U.S. Department of Health and Human Services. And the contents of this presentation do not necessarily represent the official views of or an endorsement by CMS or the U.S. government. Next slide, please. So we're just going to take a couple minutes to ask you 2 poll questions and also have a waterfall question. So the first poll question is, what county are you representing today? Fresno, Kings, Kern, Madera, Tulare, multiple counties, or none of these? And thanks, I saw some answers in the chat. You can also should have a pop-up window with the ability to select one of those choices. We will wait a couple seconds to give everyone an opportunity to respond. Let me know. I'm not seeing the number of answers pop in, so staff, can you let me know when we've got a critical mass of answers? Okay, I see some folks didn't see it pop up, but then we do have some answers here. We have many stakeholders representing multiple counties, great, and some from the various counties listed here, and others from other organizations. So thank you for that. We'll go to poll question number 2. If you are having problems with the poll, please feel free to ask for assistance from our technical team. So the question number 2 is, which of the following categories best describes your affiliation? Please choose one. Hospital, FQHC, OBGYN practice, family physician practice. We have midwife practice, doula services, local health department, county behavioral health, community-based organization, state agency, provider association, or other if it's not listed as one of the choices. Please take a moment to respond. Great. Here's our total. You can see the distribution of stakeholders today. Thanks to everyone for this really diverse representation of groups and affiliations. And let's go to our final waterfall question. In 1 to 3 words, please don't hit submit yet. Describe how you are feeling about the opportunity of the TMaH model to improve maternal health in the Central Valley. You can type your response in the chat, but don't press enter or submit until our cue, please. So just hold on to that. We'll give you a few seconds. Some possible options are you're feeling excited or curious or skeptical. We would love to hear whatever it is that you are thinking at this time. Okay, so Carmela, can I offer, it looks like folks are already hitting submit. So let's everyone hit submit. 3, 2, 1, go. Thank you. Great to see all of those answers. I love all that excitement and I love and the hopeful remarks. Thank you for offering that. So let's go to the next slide. Let's talk about the TMaH model. Next slide, please. So some background here. In January of this year, CMS announced that California is one of the 15 states selected for the TMaH model implementation. This is a 10-year delivery and payment model that's designed to test whether evidence-informed interventions sustained by a value-based payment model can improve maternal outcomes and reduce Medicaid and CHIP program expenditures. Many of the 15 states are implementing throughout the state. For California, we are implementing in the Central Valley, in the 5-county region, including Fresno, Kern, Kings, Madera, and Tulare counties. The award is $17 million over 10 years in federal funding, and we are receiving technical assistance from CMS and their contractors as well. Next slide. The model goals include to improve experience of care for pregnant and postpartum individuals, to reduce avoidable adverse outcomes such as severe maternal morbidity and mortality, to increase access to midwifery and doula services, and to reduce Medicaid and CHIP program expenditures for maternity and infant care. Now, as part of the payment model, which we are still awaiting guidance from, and we'll talk about this a little bit more in the coming slides, but we're still waiting for CMS guidance on. Some of the anticipated measures that CMS has communicated include low-risk cesarean delivery, timeliness of prenatal and postpartum care, screening for maternal depression and follow-up, and severe obstetric complications. These are, of course, subject to change depending on the final model that CMS provides. Next slide. The model consists of three main pillars. And within each pillar are required elements for the implementation. And each of the elements has activities that are called pre-implementation milestones that we are executing and implementing. Under the first pillar, access, infrastructure, and workforce, you can see here that some of the elements are increased access to the midwifery workforce, increased access to birth centers, covering doula services, improve data infrastructure, and develop payment model. The second pillar is quality improvement and safety, and that includes elements to support implementation of AIM patient safety bundles and to support birthing-friendly hospital designation. The third whole person care delivery pillar includes these required elements of increasing risk assessment, screenings, and referrals, and follow-up for a variety of conditions that affect maternal health and health-related social needs as well, and where appropriate, to increase home monitoring of diabetes and hypertension. And DHCS elected an optional element as well, that is promoting shared decision-making between birthing individuals and providers. There are additional guidance that will be forthcoming on this element from CMS. Next slide. So we all know that implementation of any care delivery model requires partnership among many service providers and organizations. So this slide lists some of those, many of the partners that are here today on this call, and really that will be instrumental in the implementation of this model. If there are partners, and at any point in this process, if there are partners who are missing or excluded, we encourage you to reach out to us, let us know, as we have been doing throughout our engagement. And we are also inviting those partners and passing along the registration for October 1st to any additional partners that you think should be present for the conversation. Next slide. This timeline represents the 10-year model timeline. You can see in orange, the first 3-year period is the pre-implementation period, and we are in model year 1. In model year 3, I will highlight that there are that some of the funding from CMS will be passed through managed care plans to participating providers. And we'll hear a little bit more about that in the next couple slides. The blue part of this timeline starts in model year 4, when quality and performance incentive payments are going to be made to participating providers. And then in year 5 and going through year 10, we will be transitioning to the VBP model that CMS will provide to us, and that will be the same across all 15 states. Next slide. So this slide highlights that transition of model year 3, 4, and 5. The implementation of the VBP model will be in 3 phases across those 3 years. We have been soliciting and received and passed on to CMS stakeholder input already, but we are welcome to also provide input on the VBP model, any experience that you have or comments that you have about value-based payment for maternity care. And here you can see that model year 3 is when the provider infrastructure payments will be made. Year 4 are the upside only performance incentive payments based on quality, performance, and cost benchmarks. And then model year 5 is that transition to the VBP model. Let's see. I think this is the slide that let me see. Yep. So it's time to pass the mic to Dr. Karen Mark.
Good afternoon, everyone. So first of all, I'm so glad that you all were able to join the webinar. I am Karen Mark. I'm the medical director here at the Department of Healthcare Services and supporting this wonderful TMaH team. So I wanted to talk a little bit more about the provider infrastructure payments. So this is $3.5 million in model year 3, which is calendar year 2027, that we have put aside for these provider infrastructure payments. So we will be dispersing these payments to what are called TMaH accountable entities via the managed care plans. And we will be getting more information on these provider infrastructure payments and sort of what a definition is of an accountable entity from CMS in the next month or so. But we wanted to start giving you all a preview of the information that we have and really welcoming your feedback as we co-develop this program together. So the information that we've gotten so far from CMS is that accountable entities that will be eligible for these payments would be like a single practice or clinic or multiple practices or clinics or providers coming together as an accountable entity. And accountable entities will likely be required to bill for a minimum number of births to participate. We have not been told yet by CMS what volume that might be. And they will be held accountable to quality measures in subsequent years. And as I mentioned, CMS will be providing us with additional guidance related to the provider infrastructure payment amounts that we will share as soon as we have it. Next slide. So many of you have probably also heard of our work on the birthing care pathway. So the birthing care pathway is a comprehensive Medi-Cal policy and care model roadmap to cover the journey of all pregnant and postpartum Medi-Cal members from conception through 12 months postpartum. And this is really a strategic roadmap that's focused on improving the care of our members throughout the entire state. And it's a series of policy solutions that address the physical, behavioral, and health-related social needs of our pregnant and postpartum members. So it's a statewide plan and process. TMaH, on the other hand, is completely aligned and complementary to the birthing care pathway, but it is being implemented in the sub-state region of Fresno, Kern, Kings, Madera, and Tulare. It does require us, because we receive separate funding from CMS, it requires us to focus on improving access, infrastructure and workforce, quality improvement, and whole person care. But we really intend for the lessons learned and the best practices that we develop through TMaH to be scaled and implemented statewide through the birthing care pathway. Next slide. So I wanted to give a brief update on our progress to date. And if you want to go forth to the next slide. So we have so far implemented managed care plan participation agreements with all the managed care plans in the 5-state TMaH region. So Anthem, HealthNet, Kern Family Healthcare, and Kaiser Permanente. So a huge thank you to our managed care plan partners who are on this call and who've been working with us on this to really help move this work forward. We also have developed initial provider participation standards that outline selection criteria for providers and monitoring processes for both managed care plans and providers. As I'll get into later, what we had to submit to CMS was an initial draft, and we will be sharing that and opening up to your all's feedback and comment, because we will have an opportunity to modify those in the future if needed. We also have been meeting bi-weekly with CMS, sharing our updates on implementation progress, and also with CMS's technical assistance contractor to get guidance on implementing some of the pre-implementation milestones. And then we've also been gathering documentation for CMS regarding where we are with completion of some of the pre-implementation milestones. And we have to have completed all of those by 2027, the end of 2027. Next slide. So I wanted to talk now a little bit about provider participation. So if you go to the next slide. So the selection criteria for providers that we've drafted thus far are, pretty basic. Obviously, providers need to have be enrolled in Medi-Cal and contracted with at least one of the Medi-Cal managed care plans in the TMaH region, since we will be doing this, both the provider infrastructure payments and the value-based payment program through our managed care plans. We also need providers to be located in or serve Medi-Cal members from the TMaH region. And as I mentioned, CMS is going to require that the providers or the accountable entities, which could be groups of providers, will have billed for a minimum number of births over a defined time period. And then providers will also need to be willing to strengthen their data collection and reporting and their quality improvement capabilities in order to participate in a VBP model. But we will be providing funding through the provider infrastructure payments to enable providers to strengthen some of those aspects so that they can be successful in a value-based payment model. And as I mentioned, we definitely invite stakeholders to provide feedback on the selection criteria. And we will, in the future, be able to post those on our website, which we are getting up and running. But any feedback can be provided to TMaH@dhcs.ca.gov or later on this call. Next slide. So by participating in the TMaH model, maternal health care providers can receive technical assistance and learning resources to aid transformation activities. They will be able to receive provider infrastructure payments to support care redesign and quality improvement efforts, and they will earn performance incentive payments based on quality performance and cost benchmarks. Partner providers and partner care delivery organizations and partner organizations will need to decide on their participation in the TMaH model by around spring or early summer of 2026. And this is because CMS has told us that we must submit the list of participants by July 30th, 2026. So we recognize that obviously people don't have all the information that they need to know about whether they would want to participate yet. We will be getting more of that in the next month or so, but we wanted to at least start this process of sharing information and getting feedback so that you all can start thinking about participation, and particularly acknowledging if you may be putting together new partnerships in order to participate. That often takes time to do. Next slide. We do have some upcoming opportunities for participation and provider feedback. So you all should have already received invitation to our October 1st stakeholder meeting. This is from 11 to 1 on October 1st. And in this, we will be breaking out into groups by county and really hearing from counties about how does maternal care happen in your county? What are some of the challenges you have? And what are some of the opportunities, if given funding, that you could help address those challenges and improve the care of the population? We will also be, CMS will also be providing additional details on the provider infrastructure payments and on the VBP model in the next month or two. And as soon as we have that, we will share that during future stakeholder meetings. We also invite you to share feedback on the TMaH model provider participation standards. And as I mentioned, you can provide any questions and feedback to us at TMaH@dhcs.ca.gov. And any feedback that you have about the development of the VBP model itself, we may very well share with CMS, since they will be developing the model on across all states. And they have encouraged us to collect feedback from providers and plans to help inform their development of the model.